Empowering Inglewood through Dr. Bill Releford's Podiatry and Advocacy. Dr. Bill Releford, a respected figure in podiatry and advocacy, has made incredible strides in transforming the health scene in Inglewood. This man's focus on foot and leg health has propelled podiatry forward. His expert knowledge has been a powerful tool in advocating for better healthcare access in places that lack resources, including Inglewood. Dr. Releford's unique combination of medical practice and advocacy has been instrumental in addressing health disparities. His work has had a significant effect on community wellness. Ceaseless advocacy from our good doctor has brought about policy changes that have benefited Inglewood greatly. He emphasizes the importance of social factors when planning health strategies. If we peel back the layers of Dr. Releford's work, we can really appreciate his deep and lasting impact on the community. Key takeaways. Renowned podiatrist Dr. Releford has enhanced health infrastructure in Inglewood significantly through his expertise and advocacy. Outreach initiatives coupled with educational programs in podiatry, pioneered by Dr. Releford, have raised community consciousness regarding foot health and preventive care. Underserved communities in Inglewood have greatly benefited from policy changes, all thanks to Dr. Releford's relentless advocacy efforts. Collaborative endeavors with local entities, as well as nonprofit engagements, have allowed Dr. Releford to offer affordable healthcare services, particularly focusing on foot care, to the community. Plans for the future encompass establishing a community health center, initiating more educational programs, and advocating for policy changes to further empower the Inglewood, California community. Dr. Bill Releford, a brief biography. Esteemed podiatrist, Dr. Bill Releford, as a community health advocate, is renowned for his relentless advocacy efforts within the Inglewood community. His young years were characterized by a potent fascination for sciences, propelling him towards a career that married intellectual curiosity with community service. His quest for knowledge did not end with his medical degree. Instead, Releford continued sharpening his skills, emerging as a top expert in his field. Utilizing his expertise, he has been instrumental in bettering lives within the Inglewood community. His life story is proof of how education, commitment, and community service can forge a successful career in podiatry. Foundational concepts of podiatry. To fully grasp the concept, one must explore its origins in podiatric education. This medical subdivision is dedicated to diagnosing and managing disorders concerning the foot, ankle, and lower extremity. It encompasses a broad spectrum, addressing usual foot care needs such as bunions or calluses and more intricate issues such as fractures or deformities. Podiatrists do more than just provide treatment. Through foot assessments, they can identify indicators of systemic conditions like diabetes or cardiovascular disease. While it may appear to be a specialized field, podiatry is an essential element of comprehensive healthcare, guaranteeing quality of life through mobility. Importance in healthcare. Podiatry, a crucial aspect of all-encompassing healthcare, is highly significant for diagnosing systemic illnesses and boosting mobility, hence bettering patients' life quality. This discipline fills gaps in healthcare accessibility, making sure foot and ankle disorders get the attention they require. These disorders could signal underlying health conditions. A lack of representation for podiatry in mainstream healthcare often results in medical disparities, leaving a large population underserved. Diagnosing and treating foot-related issues allows podiatrists to not only solve immediate problems, but also to detect and manage chronic diseases such as diabetes or heart disease. Essentially, podiatry plays a pivotal role in continuous healthcare, having the capability to significantly decrease systemic healthcare discrepancies and enhance health outcomes. The intersection of medicine and advocacy. Public health presents numerous opportunities for medicine and advocacy to intersect. Dr. Bill Releford's pioneering work in podiatry offers a superb example. His novel techniques have transformed medical procedures, leading to greater access to healthcare in underserved areas like Inglewood, California. Beneath the roof of his clinic, Dr. Releford's commitment to healthcare goes far beyond patient treatment. His focus includes training and advocacy, arming people with the necessary knowledge about their healthcare rights and options. This education allows informed decision-making within communities. Dr. Releford exemplifies the potential of using medical expertise for advocacy. His tireless efforts to expand medical service access, along with equipping people with self-advocacy tools, illustrate the potent combination of medicine and advocacy. Such integration not only improves healthcare delivery, but also promotes an educational and empowering environment. In this respect, Dr. Releford serves as more than a healthcare provider. He stands as a symbol of hope for his community, always working towards improving public health. Community health, the podiatry impact. Innovative podiatry practices implemented by Dr. Releford have had a profound influence on community health in Inglewood. His dedication to educating people about foot health and his efforts towards community outreach have left a significant mark on Inglewood's overall health. Dr. Releford's influence can be seen clearly in these key areas. Educational initiatives in podiatry. His efforts have heightened awareness about foot health, facilitating early detection and prevention of potential problems. Outreach within the community. Offering free foot screenings and healthcare discussions, he has made health services accessible to populations that are often overlooked. Emphasis on preventive care. This has been instrumental in reducing foot-related complications among individuals with diabetes. Affordability of healthcare. His clinics provide services at reasonable costs, ensuring health services are accessible to all, regardless of their financial situation. Betterment of community health. An overall improvement in community health can be seen, manifested in the reduced number of foot-related hospital admissions. Influence in Inglewood. As we shift our focus towards Dr. Releford's influence in Inglewood, we will look at the manifold aspects of his contributions. His impact on community health, his tireless advocacy, and the transformation he has brought to the field of podiatry will be the primary points of our discussion. These components not only highlight his professional achievements, but also underscore his dedication towards empowering the Inglewood community. Releford's community health impact. Dr. Bill Releford, despite facing many hurdles, has left an indelible mark on Inglewood's health infrastructure. His expertise in podiatry, along with his advocacy work, has empowered local citizens. Breaking down his influence, we see that he addresses health inequalities by initiating precise health programs for the community. Social determinants play a crucial role in community health, something he emphasizes and pushes for in health strategies. Knowledge about personal health is key, which he imparts to citizens, thus promoting preventive care. His podiatry expertise has improved foot health, reducing complications related to diabetes. Collaborations with local bodies have extended health services reach within the community. His relentless efforts have led to better health outcomes, proving that health professionals can significantly contribute to community growth. Advocacy efforts in Inglewood. Dr. Bill Releford's reviews are evident through tireless advocacy endeavors in Inglewood, moving beyond his immediate influence on community health. Central to revitalizing efforts in the city are his strategic advocacy approaches. With respect and admiration from the community, Dr. Releford utilized his influence to push for health equity coupled with socioeconomic development. His consistent call for improved healthcare accessibility highlighted preventative care's significance. Education and employment initiatives found a champion in him, thereby boosting the city's overall welfare and economic development. His commitment to underserved populations advocacy has not merely enhanced lives, but ignited a change wave. Transforming podiatry landscape. Significant strides have been made in the podiatry field by Dr. Releford, who has revolutionized this practice through his innovative approaches and dedicated service to the community in Inglewood. His innovative podiatric solutions have deeply impacted society, affecting transformation in lives and enabling individual empowerment. Introduction of new surgical techniques has improved outcomes for patients. Awareness about foot health has been increased through his community outreach initiatives. Advocacy from Dr. Releford has resulted in policy changes benefiting underserved communities. His nonprofit engagements have facilitated foot care access for individuals lacking this basic healthcare service. Mentoring by Dr. Releford ensures that future podiatrists can carry on his legacy. Through his dedicated work, Dr. Releford has reshaped the practice of podiatry, exemplifying the influential power of innovation, dedication, and community service.